AIDS 2024 or the 25th International AIDS Conference, and I have with me today a group of very vibrant youth leaders who are part of Human Touch, which is an organization led by the youth, especially in the area of HIV, sexual and reproductive health, and general health and well-being. Engaging youth for sustainable HIV response, according to me, is very, very important. Now, I hand over the mic to one of the psychologists working with Human Touch, which is an India-based organization based in Goa, led by its very dynamic CEO, Peter Borges.
Thank you, ma'am. My name is SANDHYA CHAWAN. I'm a counseling psychologist working at Human Touch Foundation as a lead for adolescents' health and well-being.
Anything you would like to say about the foundation, if you want to?
So Human Touch Foundation has been working in the space of HIV for almost now 15 years, and we have done tremendous work in this space where we are engaging with mental health counseling with the beneficiaries. Also, we provide them psychosocial support, social protection schemes are provided to them, nutritional packages are given to them to ensure that they get correct nutrition and medical adherence is maintained. Also, we look after their mental health and overall well-being by connecting them to educational spaces and providing them career opportunities.
Hello everyone, my name is MASOOMA SHEIKH, a counseling psychologist and currently holding the position of lead adolescent health and well-being at Human Touch Foundation. Speaking about young leadership is very important in HIV response, and I would like to focus on mental health services, especially young mental health professional. Why? Because having a young mental health professional plays a very crucial role wherein the young youth living with HIV can connect better with them, giving the unique challenges that they face. Also, many of our ART centers do not have adequate mental health services. They have most of the centers has only one counselor, and they are doing their job great. They are great at their job, but because just having a one counselor limits their services, providing effective services to so many young patients, so young HIV people coming to them. So I would focus that having proper mental health services in ART centers plays a very crucial role in this effort, and providing this holistic approach plays a very important role, I would say. Yes, thank you.
Hi everyone, this is Vanessa Fernandez, the Secretary of Human Touch Foundation. As my fellow psychologists have rightly said, Human Touch Foundation provides numerous services surrounding empowerment of youth and capacity building. And as I see today, the youth needs a voice, and Human Touch Foundation plays a major role in providing all these services to them so that not only mentally but even psychologically or as an economic prospect they are benefited. As a whole, I think this all needs resources and funding, and so these initiatives may be driven by youth, but youth need a place at the table, and for this we do need resources and funding. That's all I would say. Thank you.
Now let us hear the voices of the youth, who are really the true leaders of tomorrow. So my question to you is, why is it important to engage youth for a sustainable HIV response? And also, how has Human Touch affected or changed your lives in any way? Just be frank and open. There is no right or wrong answer. It's our own perception, which may be different from each other's. So why do you think it is important to engage youth for an HIV response?
I'm currently interning at Human Touch Foundation. As a youth living with HIV, I have self-stigmatized myself due to the fear of discrimination, disclosure, which has stopped me from living like a normal person. today's youth are the best equipped to lead to fight against HIV. And I'm here at the AIDS conference to gain more knowledge and become an advocate for HIV.
Can you just elaborate what stigma and discrimination did you face? So that means that will help others to tide over their own discrimination. And you talked about self-stigma and maybe internalized stigma. Was it from the family or society? And has Human Touch helped you to overcome that? And when just a little bit sharing of your life, which you think you can share.
As I say about discrimination, I have my peers have faced many discrimination at workplace, schools, and even in the society. So they have wherein they have faced discrimination from the teachers, where the teachers were not cooperating with them. Teachers were discriminating them. Means my peers were not educated properly. And whereas I say disclosure, we find it difficult to disclose our status to our family members, to our friends, and even the society, because we might get discriminated from the society, even our own families. As if means we get discriminated from our own families. Fear of we been throwing out of the house, and even our friends being separated from us.
For how long have you been in touch with Human Touch?
Um
Roughly?
from childhood, I have been touched with Human Touch. It's a good organization which has helped me overcome my fears from discrimination, disclosures, and it has helped me in various factors.
Just your experiences with facing stigma, discrimination, what has Human Touch done, whatever you want to share of your own personal experiences.
So as I am living with HIV, I have faced many type of discrimination from my own family as well as from society, even in the relationship. So if I go to speak about my own family, when they came to know about our HIV status, they just threw out. Okay, and about the society, they should tell your child to stay at home, don't tell her to come out, otherwise she will spread the virus to our kids. This type of discrimination I have faced. In relationship, I was in relationship with one guy for 1 year. After knowing him, after telling everything, but still he tells many things to me that you go sleep with other boys, because of that you get. So after knowing him, but still he discriminates me. So I have faced many type of discrimination this, and I came out from this type of discrimination only because of Human Touch, because from childhood I am touch with them, and they only have supported me with nutrition, counselling, other things. If I go to speak, many things are there, but my voice can be heard. And yeah, thank you.
As a woman, because women in India and many other patriarchal societies, they have to face, whether HIV positive or not, they have to face a lot different forms of violence, sexual abuse, physical abuse, mental abuse. So as a woman, have you felt that you have been at a greater receiving end of problems in life? Is it different for boys and girls? Have you felt that? Maybe not just because of the status, but otherwise also.
if I go to speak about you, woman will be facing many discrimination because a woman get married. If she gives birth to the child, the mother has to feed her breast milk to the child, and if she don't feed, people will ask, why are you not feeding? Boys, I don't think they face this type of discrimination because people think that whole problem is only woman. So
Your experience with living with HIV, your experience of how you faced it in society, family, and what difference did human touch bring to you? And also, I would like to know from each one of you, who put you in touch with human touch?
So yes, I got to know my status at the age of 13, and that time I was with my relatives because I had lost my parents, and that is a time when I got to know that I was getting discriminated by my own family. And the simple example will be like, I just used to use the nail cutter of theirs, the common nail cutter, and they used to say, don't use it because if little blood is also there, then it will affect us. And even food, with food they used to have sometimes separate utensils, and it used to hurt me. Before, I never used to understand that what was happening with me because of this disease, but then later on I got to know that they were discriminating me. So I was the one like who literally I searched for an institutional care on the internet by myself, and then I went over there, had a then I used to stay over there. So I was having the other peers also same like me. So I got little motivated and all. But still there was some gap like to know how and what is HIV. So that was the time when Peter sir used to work a lot for the children's in the institutions. And that was the time when I met Peter sir. And he helped me to have the documents as well. And even then sir used to have that residential camp for the people living with HIV, adolescent living with HIV. So I started attending those camps, and then there were many sessions like which were provided by doctors, and we were given more knowledge about HIV, like how it spreads and what are the causes and how you can overcome these problems. Like before, when we were at the age of when we were in 8th or 9th, we never used to understand how to go about this problem, because there was in institutional care also there are nuns and many other people, but they won't have that connectivity with us, like how to go about it. But when we went to residential camp, the staffs over there, even sir used to come with us and explain us, and they used to say it is normal to have food with non like PLHIV. It is normal to eat in sharing same food or maybe clothes or anything. Everything is a normal. It's just like how you look at it. And that is the time when I got motivated, and that is the time when I took a step and got a hope that I can be someone in our life, and that is not the end, that is not the end. I can be someone, I can do everything like other non-PLHIV can do. And yeah, that is my story with the Human Touch Foundation. And it's not the end. They even supported me for my education. I had an interest in graphic designing, and the course it was very expensive, and I got financial support through them, and I was able to complete my graphic designing course, and right now I'm a graphic designer as well. So yes, I'm thankful for the Human Touch Foundation. Yeah.
Very well said. And later on, I would like to know from each one of you what you are doing now. She has become a graphic designer. Okay, next, please share your thoughts and your insights, whatever you want to share.
Young people living with HIV are forgotten in their HIV response, so that I feel that our voices need to be heard to ensure our interest in education, livelihood, and also career guidance.
So, We have heard some young voices, and but again, I would like to ask them what they are doing currently and what specifically are they doing to spread more awareness, because I think what has come out very well in this is there is still lack of awareness and still stigma, not only amongst people with HIV but the common public, and they need to be educated more. Still some people may think they don't know the source of spread, and as somebody mentioned that eating food from the same plate will give you the virus. So why is it important to engage the youth, and what are you doing as youth to advance our efforts to end AIDS by 2030 and also educate others? Anything which you are doing, and also please let me know, are you studying, which class are you studying, or what are you doing?
So I had mentioned that I am working at Human Touch Foundation. So I am working as outreach assistant, adolescent health and well-being. So the children who are coming, the children who are living with HIV, they come to our office, and my colleagues, they provide them with the counselling, and I provide them with the nutrition. I keep all the details with me, with their health and everything. And one more thing, studies, I have not finished my studies because of this discrimination and everything. Because of this discrimination, I left my school, and even though once I left the school, I started working in the supermarket. Even there, I left working over there. So the both field I left, and I stood at home. So during that time, I went and I had provided counsel. No, they had provided me counseling, and so I had mentioned them that I am facing this type of discrimination. I need work, so I am the child who will be working and giving food for my family. Even my mom and my dad are positive. My father does not work, and my mom works, but she does not have that much of strength before when she was working. So now everything is on my head. I have to work. People talk many things, but I just ignore them.
So I am Ruth Fernandez. I'm currently doing short-term course in hotel management and also interning at Human Touch Foundation.
I'm interning at Human Touch Foundation, and now I also opt for hotel management, front office.
Well, I have had a lot to learn from you all, and all of us face many ups and downs in life, and when you have stood up to life till now, I'm sure you are going to make lot of progress with people like Human Touch people around you, and that human touch is very important, and that is why I think that is also the theme of the conference, putting people first. It is disease comes later on. It is the person who matters most to me. So I would now like to ask Peter about his experiences of dealing with the youth, the problems faced, the problems still faced, because it is, I feel I come from a different part of the world in the sense, I have never felt any discrimination against any person, but there are still people, and right now from the experiences of the youth, which I have seen, that still that stigma persists in society. So Peter, your job must be hell of a job. So can you please share, and who all are there in Human Touch? Are you catering just to the adolescents and children? Anything you would like to say, please?
So it's been a long history. 15 years, we complete 15 years in 15 years, we complete 15 years on 12th of August coming month. It's been a long journey, and so we started with the HIV program focusing on children, and as we saw them growing, we curated our program to suit their need. That's been the beauty of our, and we didn't stick to the traditional way how programs were implemented in India when it comes to children and adolescents. We created a newer concept, like she mentioned about the camps. So we create that support system, the ecosystem surrounding HIV care and support. Always Human Touch had something different to offer, and also we were the first one to give them opportunities to travel to conferences like this. This is not the only one. We have had a lot of them traveling at international platforms. So that's been the model which we are trying to implement, and lately of late we realized more focus on building their resilience. So so that's all our programs currently are focusing on building their resilience. So that's very important for us. And also lately surrounding resilience, all the issues which are emerging, like livelihood. So that's one of the biggest need we are seeing. Mental health. That's why we have two very young counselors. We also are trying to cover the whole aspect of relationships and sexual and reproductive health, because a lot of things comes, like they often try to understand, are we going to get married, are we going to have families. So that's some of the concerns which constantly comes, and we are trying to address that. So a lot of things, and of late the whole aspect of adolescent health and well-being covering. We also started work in substance abuse. We do work little on TB and HIV. And a little bit on cyber safety also now, because that's becoming more important, and we have also started little work on the child sexual abuse and surrounding the whole comprehensive sexuality education component, which we often say.
How many children, how many people you are catering to right now? Children and adolescents, and like how are they placed? Where do they live? They are living in one campus, or they are living with their families? Just a little bit on that.
We have always believed in the concept of community. We never institutionalize our children, because we believe that children are best raised in families. So we build resilience of those families. We give the support system what they require, all in the community. So we have almost 200 odd listed with us, but right now the number of client accessing services which is counseling, nutrition, should be around 100. So because we are a very small organization and we are not able to reach all the children. So that's been
What about like the medical aspect? They are on medicines. Is there viral load testing being done? CD4 count? Are you looking into that also, so that you is equal to you, and the viral load testing is done, and they know there is, or are you thinking of that?
Yes. So adherence to treatment has been a fundamental aspect of our programs. In fact, in 2016, I think, Human Touch, when viral load was still not non-existent, we filed a complaint with the Human Rights Commission of Goa, and we actually won the case. It was in our favor, and Goa government was forced to start viral load. We argued the case well, and this remains any advocacy issue surrounding treatment or stock out. We are the first one to raise voice, and we do believe that the whole medical adherence is something which all of us need to focus on. Especially during COVID times, I remember we were the first organization to go house to house delivering ARVs. We ensured uninterrupted ARV services to the people of Goa. And so treatment adherence is the main thing which we focus on. Advocacy, still we are advocating now for social protection. We have almost ensured that all of our beneficiaries are registered with the food security scheme, so that we make the program sustainable. Now of late we are trying to see how we can get them free access to free vocational training, because that's again another need. We are exploring also, there is a scheme called 20-point program, under which government can provide orphans a piece of land or something like that. So we are trying to see how whether we can ensure that.
Is that a law or what in
It's
what sense?
just a 20-point program wherein those who can't afford housing and
Okay.
orphans do fit in that scheme. So something novel we are trying to do.
Great.
And because none of them for orphans have any security as such.
So why is it called the 20-point program? Why, what is the 20 point in it? I don't know.
Yeah, so there are a lot of, it's not only for HIV focused
Okay,
program. It's pan India federal scheme of the government of India, wherein a lot of other marginalized population fit. So we need to advocate when such programs are there.
Okay, thank you. Now I will give the mic to another person who's just behind the scenes, but Kashyap, please introduce yourself, and we want to hear from you as well.
Hi, I'm Dr. Kashyap Bandodkar. I'm a postgraduate student in the Department of Oral Medicine and Radiology at the Government Goa Dental College and Hospital. And I have been working with Human Touch as a volunteer with Peter, I think, for the past 1.5 years or so. We've done a lot of camps together. I act as a medical resource person, where we've done a lot of oral screenings for PLHIVs, and we are also working in substance abuse. So if I want to summarize our trip to Munich, it has been a rich experience. We've heard firsthand the lived experiences of our patients. Usually patients come out as a figure in a report, but when you come for places like this, you realize that there is actual lived story behind those figures, and that actually helps us doctors provide better care, because I believe that humane, holistic care is something that we should approach for, which still has not percolated down to the grassroots level. So that's something that we are working towards, I would say.
Peter, there was a session yesterday on where you all participated, the pre-conference session. What were the main take-home or take-away points from that session?
So basically what I reiterated, and that was a pre-conference where faith leaders were there. So what is the role of faith leaders in supporting this young adolescent? So two of our young adolescents shared, what is that they desire, faith leaders, because we are talking about ending AIDS by 2030, and all the stakeholders of the faith community also should have plans like a contribution to that goal of ending AIDS by 2030. So they voiced similar opinions and similar things which they shared right now to the faith community, because faith communities can make a difference.
Very often they make a negative difference, but sometimes, yes, if they want, they can make positive differences as well. Kashyap, what made you enter this field and help raise awareness on AIDS?
Right. So it's a bit of a backstory with that. I'm actually doing a research project about oral manifestations in PLHIVs and their correlation with the CD4 and viral load count. So due to that, I run a twice a weekly OPD at the Goa Medical College ART Center, and so that's how I started getting involved. And I did get, I think, a little emotionally involved too, which pushed me towards trying to be an advocate for them. As you said, I think I would like to share an experience regarding faith leaders. I recently had a patient. He presented to the OPD, and he was, I think, a 30-year-old, and after he came with the complaint of difficulty in swallowing, and he had a lot of oral infections, and after taking history, it was apparent that he would probably be somebody who had HIV/AIDS. And upon probing, he said that he was a homosexual from the Muslim community, and he said he's so scared to reveal his status that he would probably even be harmed if he would reveal his status. So that's where we are, that these are the realities of Indian society, and I think it would take a collective effort for us to end AIDS by 2030. I think it may be a long shot, but it's worth the try.
Yes. Thank you very much. It has been a very, very energizing session, very energizing meeting all of you, and at least I have a lot of hope from the youngsters, although I'm sure all of us are young, because as long as you are young at heart, you remain young. So I have seen 20-year-olds having beliefs or behaving like 80 years, and 90-year-olds behaving like 20, 30 years old. So I think age, it is in the mind, it is not in years. Thank you very much for being with us today, and youth power will win and survive. And I hope one day there will be no discrimination or stigma, not only against HIV positive, but against any population, any, not what we call key population. I think all of us are key populations, and we need to overcome stigma and discrimination in different areas and spheres of life which we are facing. Thank you very much.